Good day. My name is David DeMarco, and I'm a Medicare counselor for the Department of Aging and Youth in Saratoga County, New York. The objective of this video is to present how to use the Medicare.gov website to compare Medicare Advantage plans. The Medicare.gov website is maintained by the federal government, provides an objective comparison of all available plans, and is not supported by private insurance companies. So let's get going and see how we use the Medicare.gov website. First thing you're going to want to do in your browser is type Medicare.gov. Once you've done that, you're presented with the main page for Medicare.gov. This website has a tremendous amount of useful information. If you look at the basic, you can see information about costs, your rights, reporting fraud, and other information. You can also create an account on this website if you choose to that lets you see information about your own Medicare costs and the drugs that you take. But in this particular video, we're just going to focus on how to use the website for comparing Medicare Advantage plans. So on this page, you're going to just scroll down a little bit until you see the button Find Plans Now, and we're going to press that. The next thing you're asked for is to enter your zip code. So we're going to enter the zip code for Saratoga Springs of 12866 and press Continue. We're now given a choice of looking at Advantage plans, standalone drug plans, or Medigap plans. This website is excellent for comparing Medicare Advantage and drug plans. We recommend to our clients not to use it for Medigap plans because some of the information in this website is not appropriate for New York State for Medigap plans, but is excellent for Advantage plans and drug plans. So in this particular case, we're going to look at Medicare Advantage plans and select Find Plans. If you are enrolled in either Medicaid or Extra Help or some other programs, you can select those here, and the information you see will be specific to those programs. But in this particular case, we're going to say, I don't get help from any of these programs, and press Next. You're then given the option of, do you want to see your prescription drug costs? In this case, I want to say yes, and again, select Next. I can now enter my prescription drugs. It's a very good feature they've created here. I'm going to enter one drug for lisinopril. You can see as I start typing, different names appear down below. I'm going to select the lisinopril and press Add Drug. I can then change the dosage if I want to. I'm going to say 5 milligrams. I take 1 per day, so I'm going to just leave it as I need 30 tablets per month. You can say you can change to 2 months or 3 months or 6 months if you choose to. And then I'm just going to say press Add to my drug list. There's another drug I want to add, so I'm going to press Add Another Drug, and I'm going to add Eliquis, E-L-I-Q-U-I. And you can see I haven't completed typing the whole word, but Eliquis appears on the bottom, so I'm going to select Eliquis. Again, add drug, change the dosage from 5 milligrams to 2.5 milligrams, and since there's 2 a day, I would need 60 for the month. So I'll just say Add to my drug list. So I've entered the 2 drugs I now want to add. I'm done adding drugs, so I'm going to press Done Adding Drugs. I can now select the pharmacies that I wish to go to. You can select up to 5 pharmacies. I'm going to select the mail order pharmacy. I'm going to go down and select CVS and also select Hannaford. You can select up to 5, but I'm done with the 3 I want to add, so I'm going to press Done. You're now presented with the Medicare Advantage plans that are sorted based on the prescription drugs that I entered. There's actually, if you can see here, there's 57 Medicare Advantage plans in our zip code that we can choose from. They're sorted based on Medicare's estimate of the lowest premium and prescription drug costs based on the drugs that you entered. There's a little bit of information presented on each plan. In this particular case, the plan name is Emblem Health. There's no monthly premium for this plan. And Medicare estimates that for the remainder of the year, it's not 12 months, it's for, as you can see, it's for the rest of 2024. So from March through December, since I'm doing this in February, that my cost would be $576.16 at the least expensive pharmacy that I entered based on my medications. There's no health deductible for this plan. There is a drug deductible of $395, and the maximum that you pay for health services for this particular plan is $7,550. That means that most I would pay in copays or medical deductibles, not prescription costs, but medical costs for the year would be $7,550. So a little summary is provided for each plan. You can see there's another plan, Freedom Nation. There's another plan that's a Humana plan. So you can scroll through all 57 plans if you choose to. There are some criteria you can select at the top of the page to narrow down your choices. You can select a plan type. Some plans are considered HMOs, some plans are considered PPOs. With an HMO, you must go to the doctors in your network. With a PPO, you're allowed to go outside the network. Your copays would be higher, but you do have the option of going outside. So usually people like to select a PPO to have that option. You can select specific insurance companies if you choose to. We're not going to do that now. Some of these plans do not cover prescription drugs. So we always want to make sure that we say we want plans that include drug coverage. The other thing that we usually like to select is Medicare rates all these plans up to 5 stars. Most of the rating is based on customer experience and customer satisfaction. So typically we do pay attention to the ratings. We usually like to pick plans that are at least 4 stars and up. So we'll pick plans 4 stars and up and press apply. The special needs plans are for very specific plans for people who have Medicaid or certain chronic conditions. So at this point, we're going to stop there. And you can see we've now gone from 57 available plans. We're only showing 11 plans that meet all of those criteria. The first one we see is this Freedom Nation plan, which is a Highmark Blue Shield plan. It has no monthly premium. The drug cost for the remainder of the year is $577.26. If there was a premium, that would be included in that cost, but there is no premium for that plan. So now you can scroll down through and see the 11 plans that meet that criteria. It is possible to do a side-by-side comparison of these plans. So say I want to compare the Freedom Nation plan. You can see the button at the bottom there says add to compare. I'm going to include that in the comparison. And I want to compare that to the CDPHP Vital RX plan. I'm going to add that to the comparison. Then in the bottom right hand corner, you just press compare. I now receive a nice side-by-side comparison of the Freedom Nation to the CDPHP plan. The star ratings and some of the other information in terms of that is available for these plans, the copays that would be for your primary or specialist. You can go down and scroll down through all the different features of the plans. And at the very bottom, you get a summary of the total prescription cost for the year, including the premium if there is one, at each of the pharmacies that you selected. These are the total yearly costs for the rest of the year. So it gives you a nice side-by-side comparison of these plans. If I want to see the detail of one of the plans, I can click on Plan Details. You then receive more detailed information, some of the same information that was on the comparison, but you can see your primary doctor copays, your specialist copays. You can keep scrolling down through all of these different features and copays. You can click on View More Benefits, and you get information on therapy and other copays that are available. You keep scrolling down through until you get to your drug costs. So when we get to the drug costs, the first thing we see is a comparison by pharmacy Again, these are our prescription copays for the remainder of the year for the two drugs that we picked, Eliquis and lisinopril. These are the total 10-month drug copays by pharmacy. If you scroll down some more, you can actually see by pharmacy what your drug copays would look like by month. You can see the details for a specific pharmacy. As some of you might know, there are different phases that you can go through for your drugs for the year. So for instance, with Eliquis, if you go into the coverage gap, the costs go up significantly, as you see in the cost in the coverage gap column. So you can see that, and it's all these factors here that are building into the monthly costs. That's why you see these costs go up at the end of the year for this particular person. So you see we get very good drug information, we get very good information on the copays to help you pick which plans you're interested in. You can go back to the comparison here by clicking on Go Back to Plan Comparison. We're back to this side-by-side comparison again. Say if I wanted to compare a different plan and I didn't want to see Freedom Nation, I wanted to see something else compared to CDPHP, I can click on the X, take the Freedom Nation out, go back to my plan results, and say maybe I wanted to compare it to the Freedom Basic plan instead. Add that into the comparison, and maybe add another one into the comparison, maybe the CDPHP Flex. Add that into the comparison, hit the compare button again, and I now get a nice side-by-side comparison of the three plans. It is possible to enroll on this website. We usually recommend to our clients that they actually call the companies to enroll. And again, the phone number, if you go into the plan details, you can find the name of the plan identifier, and the phone number to actually call for non-members to enroll. And that's what we usually recommend to our clients. If you needed to make changes, say you weren't happy with some of the plans that popped up, you wanted to make some other choices, you can say, I'm going to change the star ratings. Maybe I want to see more plans, so I'm going to go 3 stars and up, and hit the apply buttons. More plans will now appear because I've changed it to just 3 stars instead of 4 stars. So this is an excellent website for comparing Medicare Advantage plans. Saratoga County Office for the Aging and Youth also maintains our own website, which also has information on Medicare. You can look at the difference between Medigap and Medicare Advantage plans. There's some good information on the counseling services that we provide. There's information on cost savings programs that some people are eligible to help them save money. So we also maintain this website. So that is the summary of how to use Medicare.gov. If you have questions, you can always call the Saratoga County Department of Aging and Youth. The phone number is 518-884-4100. The program that the volunteers participate in is called HICAP, that do the Medicare counseling. You can get to our website, the Saratoga website on Medicare, at this URL that you see on the page, the tiny.cc Saratoga Medicare, or scan the QR code that you see in front of you. I hope this website and this information is helpful to help you pick Medicare Advantage plans.